This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
October is ADHD Awareness Month, and while many think of ADHD as something that only affects kids, the truth is it can follow people into adulthood, often without them even realizing it. Trouble focusing, feeling restless, or struggling to stay organized. Sound familiar? Well, those might be signs of something more. So joining us today is Beth Anne Dorman, President and CEO of For All Seasons, to help us better understand adult ADHD and what to do if you think it might be affecting you or someone you love. Good afternoon, Beth Anne.
Oh, it's great to be with you.
Thank you. So let's start off with the basics. What exactly is ADHD?
Sure. So ADHD is attention deficit hyperactivity disorder, and it is a developmental disorder that really is marked by patterns of three things. Inattention, so trouble focusing, as you said, or staying organized. Hyperactivity, which might show up as restlessness or talking excessively. And impulsivity, which is really kind of more related to the interrupting or difficulty waiting for one person's turn. And as you said, while we often see it as a childhood condition, ADHD frequently shows up with our adults as well, and many times goes undiagnosed.
Okay, so how does it show up differently in adults than in children?
Well, one of the things that we know is that it might be something where there's disorganization and someone, throughout their life may have heard, like, you're just a disorganized person, or maybe they're having a difficult time getting to a deadline. Maybe there's some procrastination. And at times when we're adults, we just think of things like, well, we're really busy. There's just not enough brain space. People talk about in women that it might be menopause brain, or men just might not be paying attention. So sometimes we create the situations where it might be dismissed as something different, when if we do take a step back and think about how is our life working on a daily basis, there may be some things that indicate that there might be some help that might be needed to really address a true condition that doesn't have to exist without assistance.
Okay, so how common is ADHD in adults?
Well, we know that on an average, between 6 and 10% of adults are late diagnosed with ADHD. And again, we know that there's some folks who have not gone to seek any assistance and or talking to a professional about ADHD, but we know somewhere between 6 to 10% of folks are diagnosed, and it's more common in men than it is in women, and more commonly it's often misdiagnosed within the men population. So really thinking about evaluation, thinking about the ways that we can talk with our mental health providers as well as our general practitioner providers is a really important thing when it comes to adult ADHD.
Now, I know a lot of people probably, when we were discussing what ADHD is in adults, probably thinking, yeah, that sounds like me. Are there any red flags we should be looking for that maybe would indicate we need to see a professional?
I would think if it's something that we're noticing that impacts our ability to live our daily lives in a way that reduces stress and anxiety. If you can imagine someone who is living in a chasing their tail environment, maybe continuing to procrastinate or miss deadlines, trouble managing emotions or routines and relationships can also be symptoms that we need to pay attention to. Then things that impact our daily work performance, our daily life, and really ultimately then impact our self-esteem or our ability to feel like we're accomplishing things and doing it well.
So once we reach that point, what is the diagnosis process like?
Well, one of the things that we know is that the internet is great for helping us to learn some things, but we really encourage folks to seek the help of either a general practitioner or a mental health therapist. There may be some things that you can look at on the internet where we can look at signs and symptoms, but we caution folks not to use that as your main piece of information. We want to talk about behavioral strategies, and that's what therapy can bring. So it might just be that you need to have different behaviors and strategies that we're putting in place to help address some of these things. There's also the possibility that somebody might get talking with a therapist and be referred to a psychiatrist, because perhaps medication can help to equal out the chemicals in the brain that would assist with reducing the symptoms of ADHD. And so we would encourage you to reach out to your general practitioner, to your therapist, and or For All Seasons. We have the ongoing open access appointments every day, walk in or telehealth in, even just as a check-in. It never never hurts to just seek some advice from guidance of a professional and being able to then see what's the possibility to help reduce some of the symptoms that you're experiencing.
Exactly, and it could lead to a diagnosis and treatment and a better life. Beth Anne Dorman with For All Seasons, thank you so much for joining us this afternoon.
Thank you.